Okay, so some eye-related emergencies that you need to be aware of. We can be in the position of teaching patients how to respond to these. So if there's a foreign object in the eye, and we're talking about something small enough, not something sticking out of the eye, but like there's a foreign object out of the eye, we can use the moist corner of a sterile gauze pad to remove that. We want to, or we may try to irrigate it out, but we want that patient to avoid rubbing. For chemical burns, we want to irrigate the eye copiously for 20 minutes, turning the upper eyelid kind of inside out to make sure we get the fluid in there. The patient should rest with their eyes closed in a darkened room and should go to the ER as soon as possible. For ultraviolet burns, both eyes need to be patched completely closed. They need to rest with the eyes closed, and they need to go to an ophthalmologist. Hematoma, a flashlight can sometimes make a hyphema, which is bleeding into the anterior chamber of the eye, visible, but they should ice for 24 hours, and that's obviously alternating ice on, ice off. See an ophthalmologist if there's any hyphema, and rest with the eyes closed. Now, penetrating injury, this is the pencil stabbed in the eye. I don't do eyes, guys. We should teach people, don't try to remove that object. They need to go to the ER. We need to be observing for fluid leaking, hyphema, perla. They're going to put a shield over that, usually until they get to the ophthalmic surgeon. The unaffected eye needs to be patched, because if I have this eye with something stuck in it and it's covered, but I move this eye, my other eye is going to go with it, and that's going to increase the damage. So both eyes need to be covered, and they need to get to an ophthalmic surgeon. So eye-related emergencies are scary because they can result in vision loss. All right, we're going to start talking about, in the next section, we're going to talk about deformities of the skull.